Can you see the subtle issue on the CT scan? This is a CT scan of a patient who had lower back surgery a few years ago, did relatively well, and then slowly began having pain again. So we were looking for the cause of it, and we requested a CT scan, but unfortunately even the radiologist couldn't pick up the subtle abnormality that we were looking at and really was the cause of the patient's pain. So this is a sagittal view of the CT scan. This is the lateral view. We're looking at the side, and here we can see the screws that are going from the back of the spine all the way to the front into the vertebral body. The screws seem to have been placed appropriately. There is a cage in the front at the L4-5 level, and there does not seem to be a big fusion mass, and I don't really see a solid fusion anywhere. This is the axial view. Here we can see the screws again, and lots of information we can get from the CT scan. And this is the spinal canal, and these are the screws that were placed. And the screws also seem to be placed well. This little horseshoe cage is also at the center of the disc space that was removed, and these two little markers are from the manufacturer, so it shows us where the implant is placed, and that also seems to be appropriately placed. This is a 3D reconstruction CT, and here we can see the rotation of the spine, the pedicle screws, and the key image is this reconstruction image, and not sure why, but the radiologist did not pick up on it. And here we can see that this interconnecting rod is broken. Very subtle, but it either came out of the screw or it's broken, but it seems that it's broken because the tip of the interconnecting rod seemed to be here within the screw itself. The screw's looking good. This rod broke. This is because it didn't completely fuse, and as there was slight micro motion, eventually this screw broke. Now the question is, what are we going to do? Depending on how much pain the patient is having, we could possibly leave it alone if the patient can tolerate the situation and if there's not too much pain. Alternatively, we can go from the front of the spine, because the operation was performed from the back. We can go through the abdomen, try to put bone graft here and remove these screws. Or we can go from the back of the spine, remove the screws, put more bone graft, and another option is to put bigger screws, put more bone graft, and try to get this thing fused again. This is somewhat complicated, but probably fixable. Thankfully, the patient is not very symptomatic, so we'll have to talk to the patient, see what they want to do, and make a surgical plan.